Gentlemen, let me start with a truth most men never want to face. If you're over 60 and your mornings feel weaker, if you're waking up 2, 3, even 4 times at night to use the bathroom, or if your body just doesn't respond the way it once did, this is not just aging. It's a warning. Because what I'm about to reveal tonight is information most doctors never tell you. And yet, it could mean the difference between slowly losing your vitality or reclaiming the strength, confidence, and power you thought was gone for good. This isn't hype. This isn't theory. It's about your blood flow, your prostate, your hormones, the core of your manhood. And if you stay with me until the very end, you'll discover the exact habits that are silently destroying your body, and the simple, nightly ritual that can help reverse the damage. But let me be clear, miss this, and you'll keep wondering why your energy fades month after month. Watch it through, and you'll finally understand how to fight back. So before we go any deeper, do this right now. Hit subscribe, tap the bell, and like this video. Because every week I bring you dark, hard-hitting truths about men's health that no one else dares to say. All right, let's begin. Have you ever stopped to think that the way you touch yourself today might not be what your body actually needs, especially after 60? You're not the only one. In fact, this is one of the questions I hear most from older men. Not only is it okay to masturbate, but how to do it in a way that's safe, respectful, and truly supportive of your health, instead of draining it. I'm Dr. Sofia Carter. I've worked with thousands of men just like you, men who want to stay in tune with their bodies, feel secure in their sexuality, and grow older with dignity and strength. And in today's video, we're going to address something rarely talked about but incredibly important: how to masturbate safely after 60, plus the 3 big mistakes you really need to avoid. This isn't about shame. It isn't about performance. It's about protecting your circulation, your prostate, your hormones, and your emotional health. If you've ever felt unsure about what's normal or what's safe, you're in exactly the right place. Let's begin with why this matters at all. First, let me reassure you of something essential. Masturbation isn't just normal. It can be genuinely healthy, particularly as we age. As the years pass, many men start to wonder whether their body still benefits from this kind of release, or worse, they feel embarrassed for still wanting it. Here's the truth. Regular, gentle self-stimulation is one of the simplest, most natural ways to support male health after 60. It helps keep blood moving through the penis, nourishes the prostate, lowers stress hormones, and can even improve sleep by soothing the nervous system. But, and this is critical, the way your body responds to touch in your 60s or 70s is different from how it did in your 20s or 30s. There's no shame in that. It's not failure, it's biology. Self-pleasure benefits. As we get older, our skin thins. Nerve endings that used to fire instantly may need a little more coaxing. Blood vessels, especially in sensitive regions, can react more easily and strain quicker. That's why your approach to self-pleasure has to evolve with your body. This isn't about pushing harder or chasing intensity the way you once might have. It's about tuning in, being mindful, present, and listening to your body with care, instead of treating it like a machine that needs fixing. When you slow down and engage with yourself more thoughtfully, the experience not only becomes more enjoyable, it's far better for your long-term health. Many men never hear this. No one tells them that old patterns may no longer serve them, so they keep doing what they've always done and end up frustrated, disconnected, or even a bit sore physically and emotionally. The moment you realize your body wants something different now, slower, kinder, more nourishing, things begin to change. A new kind of pleasure opens up, one that feels deeply connected and restorative. Which brings us to the first mistake so many men make, often without realizing it. The first major mistake I see again and again is rushing. It sounds small, but I want you to really consider it. Because the impact of hurrying through self-pleasure at this stage of life is bigger than most men realize. A lot of older men treat masturbation as something to get over with. It becomes a fast, tense habit, often done quietly and in secret. The truth is, this kind of rushed stimulation can quietly work against you, especially after 60. The first mistake. Here's what happens when you rush. Your nervous system stays on alert. Your blood vessels constrict instead of opening. Your heart rate can climb, but not in a calm, healthy way, more like stressed, shallow breathing. Your brain is still scanning for interruptions. Instead of allowing deep, nourishing blood flow to the penis, your body stays guarded. You don't fully relax into sensation. The result? You may finish feeling unsatisfied, a little sore, or find it increasingly difficult to become aroused at all. When this pattern repeats, your body learns to associate touch with tension, not with safety and ease. Arousal, which should be smooth and enjoyable, becomes mechanical, rigid, less responsive. The good news, you can absolutely change this. Start with a simple shift. Give yourself more time. A few extra minutes to slow down. Breathe deeply and actually arrive in the moment can transform the experience. You don't need a spa ritual, unless you want one. But creating a small window where you're not distracted, not checking your phone, not bracing for interruption, tells your body it's safe to let go. When your body feels safe, vessels soften, nerves wake up, and tissues respond again. That's when true satisfaction returns, not from pressure or speed, but from presence and the gentle attention your body has been asking for. The second mistake. The second mistake, very common and often learned over time without noticing, is using. Too much pressure. I can't emphasize this enough. Many men after 50 or 60 grip more tightly or move more aggressively during self-stimulation. Sometimes it's habit. Sometimes it's because sensitivity feels reduced and they're trying to feel more. The intention is understandable, but the outcome can backfire. The penis isn't just skin and muscle. It's delicate, sponge-like vascular tissue, highly sensitive nerves, and connective structures that respond best to steady, gentle stimulation. Repeated tight gripping creates friction, compression, and strain. Over time, that can blunt sensitivity. Nerves stop responding like they used to. Some men develop what's informally called death grip syndrome, where their body only reacts to one very specific pressure and motion, usually their own hand. That makes partnered intimacy harder and natural arousal less likely. It can also cause soreness, irritation, or micro-tears you might not notice at first. If that tissue gets inflamed or irritated, future stimulation can feel less comfortable, less enjoyable, and more stressful. That cycle is real, but you can break it. The fix is all about gentleness. Loosen your grip a notch. If it feels odd at first, that's okay. Your body can adapt over days or weeks. Use a natural, fragrance-free lubricant to reduce friction and protect the skin. Shift your focus from finishing to how it actually feels. Breathe deeply. Relax your shoulders and jaw. Think of this as therapeutic touch, meant to keep tissue healthy, circulation moving, and your mind in sync with your body. The more patience and kindness you bring, the more rewarding it becomes. You don't have to force pleasure. You create the right conditions and allow it. Now, the third mistake might surprise you because it isn't about technique, it's about how you feel. Ignoring the emotional side of self-pleasure is something many older men have done for years without realizing the cost. Most of us weren't taught that emotions and hormones are connected, that thoughts, memories, and stress levels shape our experience of touch and arousal. For some, this shows up as shame. Maybe you were told masturbation was wrong or something to hide. For others, it's about the changes of aging, how your body looks, how it responds, how long it takes. Slowly, those thoughts become quiet stressors. You start asking, am I normal? Is this okay? Instead of comfort, you feel tension, guilt, or avoidance. Here's the thing. Emotions you push down don't disappear. They lodge in the body, in muscles, in your breathing, even in blood flow. Over time, this emotional weight can trigger performance anxiety, disconnection, even low mood. For many men, that loss of connection turns into a loss of desire, not because the body can't respond, but because the heart doesn't feel safe. So what helps? Start with compassion. Remind yourself this isn't about proving anything. It's about connection, healing, and caring for yourself in a deeply personal way. If that's hard, that's okay too. Talk to someone, a clinician, a therapist, or a trusted friend who understands. There's nothing weak about seeking support. It takes strength to open up about something this personal. You deserve to feel safe in your own skin. You deserve to enjoy your body at any age. Being honest about your emotions can be one of the most powerful steps toward that. This isn't just about physical release, it's about self-respect. It begins by letting go of shame and replacing it with understanding. Now that we've covered the 3 biggest mistakes, let's move to something hopeful. Creating a healthy, safe, satisfying self-care routine that includes masturbation, one that supports your health, honors your experience, and feels good, in every sense of the word. Start with hygiene. Wash your hands. If you use any tools, cloths, or towels, keep them clean. Set up a space that feels quiet and calm. Somewhere you can be alone, unhurried, and relaxed. Use a natural, unscented lubricant to protect skin and make everything smoother. Always pay attention to your body's feedback. If you notice pain, tightness, swelling, sores, or irritation, don't ignore it. Those can signal inflammation, circulation issues, or even a prostate-related problem, something a doctor can help assess. Done gently and mindfully, this practice can become a source of well-being. And if you feel uncertain, or like you're starting fresh after years of disconnect, that's perfectly okay. Many men rediscover connection with their bodies in their 60s or 70s. That isn't regression, it's evolution. It's learning what your body needs now, not what it needed decades ago. That's a beautiful thing. You're not broken. You're not past your prime. You're in a new season of life, one that asks for more care, more intention, and more kindness. When you respond to your body with that kind of care, it responds back, often in powerful, wonderful ways. So tonight, or whenever you feel ready, give yourself the gift of attention. Not performance, not pressure. Presence. You deserve that. And if this helped, consider subscribing, because your body still matters, your pleasure still matters, and your confidence is worth protecting. Until next time, stay strong, stay curious, and take good care of yourself. If you'd like a simple framework to follow, think of it as a warm-up, explore, and unwind sequence. Warm-up. Take 2 or 3 minutes just to breathe slowly, relax your shoulders, soften your jaw, and let your belly expand as you inhale. This signals safety to your nervous system. Explore. Choose touch that's slower and lighter than your old go-to pattern, and notice how sensation builds when you aren't rushing. Unwind. When you're done, whether you climax or not, place a warm hand over the lower belly or perineum for a few breaths. This helps your body settle, supports pelvic circulation, and leaves you calm instead of depleted. You're teaching your system that pleasure and recovery can happen together. Let's talk lubrication for a moment, because it makes a bigger difference. After 60, a natural, unscented, hypoallergenic lubricant reduces friction and protects delicate tissue. Water-based options are easy to clean. Aloe-based can be soothing. A tiny amount of high-quality oil can work if you're not using latex barriers. Avoid fragrances, warming chemicals, and numbing agents. Those can irritate skin and blunt healthy feedback from your nerves. If your skin is prone to dryness, consider a brief warm shower before and a pea-sized amount of plain moisturizer after, not inside the urethra, to support the skin barrier. A quick word on the pelvic floor. Those sling-like muscles support erections, ejaculation control, and bladder function. If they're too tight, common with stress or years of clenching, sensations can feel edgy or numb. If they're too weak, firmness and control can suffer. Gentle, relax, then engage practice helps. Inhale and imagine the pelvic floor widening and dropping. Exhale and gently draw it up as if stopping urine flow. About 30–40% effort. Not a hard squeeze. Do 5 to 8 slow cycles. Over weeks, many men notice steadier arousal and less post-activity tension. When to pause and seek medical guidance. If you notice persistent pain, curvature that's new or worsening, visible plaques, repeated micro-tears, blood in urine or semen, numbness that doesn't resolve, fever, burning urination, or sudden erectile changes after starting a new medication, get evaluated. Some blood pressure meds, antidepressants, and prostate drugs can alter arousal patterns. Do not stop them on your own, but do discuss alternatives or timing with your clinician. Your safety and long-term function come first. Let me share 2 brief clinical snapshots that illustrate this shift from force to presence. Case 1. A 66-year-old retired engineer felt checked out from his body and relied on a tight, fast routine that left him sore. We swapped to slower touch, added breathing, a mild lube, and 6 weeks of relax then engage pelvic floor work. Result: less soreness, easier arousal, and, his words, enjoyment instead of effort. Case 2. A 71-year-old widower carried shame and avoided self-touch for years. With compassionate reframing and a 10-minute light-slow ritual twice a week, sleep improved, mood lifted, and morning fullness returned. The body responds when it feels safe. If you prefer non-manual options, there are body-safe sleeves and soft silicone tools designed for low pressure, high glide. Choose textures that are gentle, avoid extreme suction or intense vibration, and keep sessions short while you retrain sensitivity. Clean with warm water and mild soap, allow to dry fully, and store away from heat. Again, the principle is the same: less force, more feedback. Consider the whole-day inputs that shape nighttime arousal. Hydration, a brisk 15–20-minute walk, light mobility for hips and lower back, protein plus colorful plants at dinner, and limiting alcohol close to bedtime. A calmer nervous system and better blood flow during the day set the stage for better sensation later. Small, boring habits create surprisingly big changes where it counts. To recap your after 60 self-care blueprint: slow the pace to switch your body from tension to safety. Lighten pressure and protect tissue with a simple, clean lubricant. Relax, then gently engage the pelvic floor for balance, not brute force. Bring your emotions with you. Compassion reduces performance noise. Watch for red flags and loop in your doctor when something feels off. Treat this as maintenance and nourishment, not a test you have to pass. You are not broken. You are adapting. When you meet your body with patience, curiosity, and care, it meets you back with responsiveness, comfort, and a steadier kind of pleasure. Give yourself that chance. If this resonated, consider subscribing. Your body still matters. Your pleasure still matters. And your confidence is worth protecting. Until next time, stay strong, stay curious, and take good care of yourself. Gentlemen, now you know. The small choices you make every single night can decide whether your body grows weaker or stronger. This simple ritual may look small, but it's a signal to your blood, your hormones, your prostate, that you're still in control. Your best years are not behind you. They're waiting for you to claim them. So here's what I want you to do: subscribe right now, hit hit the bell and drop a comment saying, "I'm ready." Because this journey doesn't end here. Every week, I'll bring you more dark, hidden truths about men's health, the kind of knowledge that can change your future. And don't go anywhere. The next video reveals 3 everyday habits that silently enlarge your prostate and how to break them before they break you. Remember this: your body is still listening. Give it the right signals and it will answer. Stay strong, and I'll see you in the next one.